Hello, this is Anne DeGheest. This is November the 6th, 2020, and this is the Anne Insights channels regarding the two COVID updates videos you're going to be watching, I hope. The first one is on epidemiology, which is record-breaking this week. We are passing around 50 million people worldwide, 10 million people in the US, and the US now has passed over 120,000 cases per day. We're going to be looking at the Spanish flu lessons that we have learned, especially looking at what's happening in Europe, which is having a massive second wave, which may be predictive of what may happen in the US. The second video is going to be focusing on what you can do to decrease your infection risk. That means boosting your immune system. What are the protection you can do to basically have the right mask, how to maintain this mask, how to use them right, what you should be aware about the environment, ventilation, humidity and all of that. What can you do to decrease your chance of getting infected in the situation where the virus is everywhere? We also to talk about the fact that the PCR may not be reliable for the first 3 days, and also how long the antibodies are lasting. So please stay safe, and if you like this video, post them. We really need to reach out to as many Americans and people around the world to stop this virus who can be so devastating. Stay safe. Hello, this is Anne DeGheest, and this is November the 6th. It's the Anne Insights channels on YouTube. We do two videos. The first one is going to be on epidemiology, and the second one on the clinical. This is the epidemiology one. And just to keep you into the spirit, this is Halloween, wasn't that long ago, so I want to kind of get you ready for the slides, because unfortunately I don't have great news, but I want you to get into a hopefully uplifting spirit. So what's happening in the world? Sorry for my computer. The virus winter is here. If anybody of you follow the HBO series, it's no longer the winter is coming. Unfortunately, the winter is here. And I'm going to talk a little bit about what's going on. Worldwide, we have 49 million cases. Probably by the end of the weekend, we'll be passing 50. 1.2 million deaths in the world. The US has officially passed 10 million cases today. We broke all our records with over 120,000 daily cases, and it's accelerating, unfortunately. You're going to see that Europe is on the rocket to the moon. This is the only way I can explain this. This is Europe, this is North America. So you can see we're having a huge problem in Europe. And the reason why it's concerning, because Europe is usually a month ahead of us. So this may be what's coming to us. So I'll be spending some time on what we are learning from Europe and other parts of the world. You can see some good news for South America and Brazil, as well as India. So I'm going to be focusing this week on North America and Europe. And I'm going to compare this to the Spanish flu, because this is looking like the Spanish flu second wave. In the second video, which is a separate video, I'm going to say, what can you do to protect yourself? The virus, unfortunately, is everywhere in the community in the US. We're all going to be exposed, but there are things you can do to decrease your chance of being sick and infected. So we're going to review all of that. So you can really see on this graphic here in green, Europe is really exploding in the last 60 days. You can see that green part is really exploded there. And then we had that Indian problem there in Asia there, which they're really doing a great job at controlling there. And then unfortunately with the US, we had that big wave in the summer. And now unfortunately, we're going straight back up. So you can see, unfortunately, this virus is still extremely aggressive in the world. Worldwide, 49 million cases. At the rate we are adding it, we're adding 530,000 cases per day. And 500,000 cases per day. And that means that by Monday, we're going to pass 50 million worldwide. And unfortunately, we're leading the world. And then because we're accelerating in India is going downwards, it looks like we're going to continue to be the leader in the world for a long time. So looking at a rolling 7 days average to kind of smooth the curve, this is what's really worrisome. This is the number of cases on a daily basis there. And we have passed over 120,000, and we're not slowing down. This is not a small progression there. And unfortunately, what's really worrisome, it's the same type of curve that Europe is going through. And so there's a lot of similarities. So we're going to spend a bit of time on what we can learn from Europe. India is doing a great job. Look at how they dropped. They were #1 in the world like a month ago, and now they have dropped by half their daily cases there. Russia is also having a bit of an increase. And we talked about a couple of weeks ago about Israel having a problem. They did a massive lockdown and crackdown, and they've done a great job now at controlling it. So it can happen. On a worldwide basis, the US is, I think, 2% of the population, if my memory is right, but 20% of the cases. So we're still, unfortunately, number one. India, of course, being number two. And Brazil, I had this huge surge several months ago, is number 3 in the world. Let's learn from the Spanish flu. This was the big fear we all had. Is this going to be like the Spanish flu? In the Spanish flu, they had 3 waves. The first wave was a small wave, and that was while the war was still going in Europe, so most people did not really address it and kind of ignored it. And then the second wave came, and the second wave was the one that was catastrophic. And what happened is that they had super spreading event. They celebrate the end of World War II, and this is to give you an idea, what I call super spreading event, high density population there. And literally, if you look at Philadelphia, they had a parade of 200,000 people, and 10,000 people died within 30 days just because of that event. St. Louis canceled the parade and the parade, and then they had only 700 dead. So controlling the super spreading event is something we need to really get concerned about, which is why a lot of people are concerned about Thanksgiving and demonstrations and things like that there. So the key is that, are we having a similar situation? What can we learn from what happened in 1918? So in green are the cities that did a lot of distancing. So they forced people to basically wear masks and be apart, and don't get too close, and basically stop all the gatherings. So a lot of the things we're going through. In red are the cities, for a lot of reasons there, who decide not to do that. Okay, and the relationship here is their relationship between the mortality rate and the change in employment. And the point of this is that more mortality created less employment after the pandemic. So the whole argument that we have been hearing about, well, we cannot lock down the economy because, if we lock down the economy, we're gonna, we basically have an impact on mortality. These two are related. And what they've shown in 1918 is that if you don't take some of this protection there, your economy is going to be hit harder instead of less. That's kind of the key lessons to take away from this. So let's look at the second wave. To give you a perspective, here's the first wave. Remember, we all were saying, oh, the poor Italian and the Spaniards there and all of that, how horrible that was. Look at the magnitude. It's like 5 times. And that's why we're very worried, because it looks like the second wave that the Spanish flu, put us through. There's a lot of similarities there. Now, Belgium had the highest rate, totally out of control. They we'll spend more time on that, a total lockdown. Very, very, people could only meet 1 person per week and something like that. And to their credit, you can see, boof, it went straight down. Czech Republic, massive also outbreak. But look at the rest of Europe, Germany, Spain, Italy, Netherlands, France, Switzerland, all of them straight up. And to give you perspective, this is the US. So I'm going to show you the US is not doing well, but Europe is doing significantly worse. And if they are like what happened in the spring, which is 1 month ahead of us, this may be some of the things that's coming at us in the next 2 months. So to give you perspective, this is the US. We're still in the first wave, in the third peak of the first wave, because we never went down to the bottom like they did in Italy. But Italy, remember how they had all these deaths and all of that, and they had an incidence of 5,000 cases per day. They're close to 30,000, 6 times higher. So it is worrisome. United Kingdom, same story there. They're going from 5,000 to close to 25, the massive lockdown. Germany, who is so controlled, everybody was kind of so jealous of how well they did things. They're not being hit as bad, but it's still a good 4x. So what is happening? The positivity rate exploded. Czechoslovakia was having a 30% positivity rate. Belgium, where people were wearing masks and they were trying to do things, they went as high as 25%. And this is the interesting thing. In July and August, people went on vacation. A lot of people went to the Spanish beach. There's a Spanish mutation there that they're able to track down, and they brought it back to the northern country, like Belgium, France, and Germany, and all of that. But what is really surprising everybody is the speed. It's from September the 27th. That's when you have the inflection point. So it's a period of 6 weeks that you have this really big explosion here. So Europe is under curfew. They were not under a curfew in the spring that I know of. And that's because the European health system is near maximum capacity in the hospital. It's the same thing that happened to Israel. The school opened. They had the first rise. between 15 to 25 years old, and then a lot of the people went on vacation in the summer there, so they were the carriers. Most of them were asymptomatic. They passed it on to their parents, who passed it on to their grandparents, and that's when you have the mortality that happens 4 to 6 weeks later. So in a curfew there is between 11 p.m. to 6 p.m. in Spain until May 2021. That's 6 months. They're basically banning mixed households. They have a lot of lockdown. Every country is slightly different. France is 2/3 of France, 46 million people are in some type of curfew. Austria, Greece, it just goes down the list. They're shutting down the bar, the restaurants, the stores, the non-essential stores, fitness theaters, pretty much. And then my friends in Belgium they just say, well, where do we go if there's no bathroom available? You can't even go to a bathroom. And so in Belgium, they shut down for 6 weeks because they had this big problem, and they were only allowed to see one person per week. So if you're a grandparent, you can choose your daughter for a week, or you can see your grandchild to see a couple of times a week. That's what they're talking about. They shut down the university that was in person, which they believe is one of the reasons why it created a spike, and not doing online. They cancel all elective surgery because they have a capacity issue. Sounds familiar? It's the same thing that happened in the spring. Germany, they're putting together $10 billion euro government aid so they can pay up to 75% of the lost sales for company of less than 50 employees. They're trying to protect that small service industry there that we're destroying right now in the US. And France is basically shut down for a month, and England, not the UK, because they have different legislation power, until December the 2nd, and they're paying 80% of the furloughed wage support. So in Europe is doing everything they can to support the economy. Another thing that just happened is that the mink, which is this fur that is coming from an animal there, it turns out there's a mutation. And there's a mutation that happened on this mink that unfortunately seems to be able to be could spread to humans. It doesn't seem that it has happened yet, but when they did the analysis, it's capable of infecting humans. So in Denmark, they're basically killing 1.4 million animals to try to decrease the quantity. They had an outbreak in Wisconsin where 3,000 mink died in the last month from COVID. So the last thing we want to do is to have a mutation in an animal, and then it goes back to humans, because that's how this whole thing started there. So I think we need to keep an eye on this. So this is the cute little mink. Belgium, let's take a bit of time on these two countries. Why did they explode? And people are trying to figure this out, but the positivity rate went from less than 2% to 18 to 25 to 35% in a matter of weeks. So it's clearly an outbreak. It's not doing more testing. Belgium, for example, has one of the highest density in Europe. They have 3 times the average density than Europe, so therefore it's easier to pass the virus on. The university and the school reopen, and that's clearly linked to what accelerated the outbreak. And the reason is in Belgium, people go back home in the evening because it's a small country, or on weekends. It's not like here where you stay on the campus and you can kind of control the infections there. And they have 2,000 contact tracer, and they can barely follow up on 50% of the people that have been infected. So the system is totally overwhelmed. As a result of that, they have curfew at night. They close the bar. They close the shops. They have, to give you an idea, there's a population of 11 million people, and 16% of the population is downloading an app of what they can and cannot do, because every part of Belgium has different rules to make things a bit complicated. Let's look at the R reproduction number. If you remember, the R reproduction number is if you are infected, and if you infect another person like the flu, the average is 1.2. So you basically infect 1.2 person for every person that gets infected. The problem we had with the COVID is that the ratio was 2.5 to 3. So it's much higher contagious and infection rate. And so there's a study that came out of the Lancet, which is a very prestigious British journal, looking at 131 countries that did 790 intervention phase. And what they looked to say, okay, is there a relationship with some of this lockdown and the control of the R? And what they show is that after 28 days, so it takes 3 to 4 weeks in this case, they were dropping the R significantly. And what they show is they say, what is the one that's the key determinant? And what they came up is school reopening and lifting bans of gatherings of over 10 people were the one that basically created a new outbreak. It's kind of the study there. And basically, if you look at the data there, I know it's a bit overwhelming there, it ties when they did the opening up of the economy, and what were the two factors that seems to be tied to the increase of the R. And what you don't want is what you see here, which is the R that was under control over here, went all the way up, to 1.3, 1.4. So that's when you have the outbreak. And when you had the ban and the lockdown, you can see it dropped to the fact that the infection wasn't being spreading there. So there's two lessons there: is the school opening and the ban on gathering over 10 people were the two key determinants in allowing the outbreak to come back. Let's look at the surge. The numbers are absolutely amazing. So if you look at the new cases per million, which is the way this is ranked, Belgium, if you remember, 2 weeks ago was over 850, was one of the highest number in the world. The good news for them, they have dropped by a factor of half by doing the lockdown and putting some of this restriction there. France, unfortunately, is going straight back up, and that's why they're starting to put some of these new restrictions there. So they are really battling there, and you can see it really happened really, really fast. The question is, what about mortality? There's some good news there. If you look at a person who gets infected, who get admitted to the hospital, what's your mortality rate? And the good news there is that we have really learned as healthcare providers to really take better care of people. And so the mortality has dropped significantly. So there's a study from New York where they look at people between March and August. In March, you had a 25% mortality rate if you were hospitalized. This is when the system was totally overwhelmed. And now if you get hospitalized, you have a 7.6% mortality rate. So that's an 18% point drop, which is quite significant there. And that was a very large study on 5,000 hospital people. In the UK, they were even better than that. They had a 28% point drop. So they went from 29% mortality to 10%. And so that's the good news, which is if you get into a hospital right now, because there's this new outbreak, you have a higher chance of surviving. And so they believe it's the better protocol. We treat people much earlier with blood thinners, and we identify the cytokine stores, and we give the steroid much earlier than we used to do before. And then everybody's wearing masks. And one of the things I'm going to talk about in the clinical video is that it's critical to wear the mask because not only does it protect you for not getting exposed, but it decreases the viral load. And there's a strong relationship between the amount of viral load that you absorb in your body and the severity and the death rate. And so wearing a mask will decrease your chance of having a severe case. And that's what they're discovering in Europe. So unfortunately, because you have that huge outbreak of a factor of 5x, despite the fact that we're doing a better job when you get hospitalized, the mortality rate has absolutely exploded. If you remember 2 weeks ago, we're not sure where it was going. Say, well, this is just infection, nobody's dying. And of course, as you know, they give it to different age groups. And unfortunately, when you hit the elder populations there, you see this massive increase in mortality. And this is death per million people, so it's all normalized there. So you can see that Czech Republic, Belgium, and all of that, as the healthcare system gets overwhelmed, you have the mortality curve that unfortunately followed. And that's the big worry we have in the US, that the same things could happen to us by December and January. So if you look at the mortality, there's another very interesting study that was published in Nature in the last 2 weeks. And they look at the data of 45 countries, and they look at the seroprevalence. So in those countries, and you can see it's most of the developed countries in the world there. Here's the USA in the middle. They give you some relativity there. The infection rate that's reported cases is 5% now in those countries. And we know we're underestimating some of these infection rates. So we're already 5 to maybe a higher percentage of the world that has been infected. And that's kind of stunning in the next 6 to 7 months. And you can see that some part of the world, have an infection fatality rate, which is the RFR, which is you have been diagnosed with COVID and what's the percent of you that's going to be dying from that. And the good news, if you look at everybody, mild, medium, outpatient, everything else, not people hospitalized, the US is around, looks like a bit less than 1% there, but you can see depending on the country, like Spain, Germany, and all of that, have a high mortality rate. That's because probably the average population is older in their population group. And the interesting thing is that based on the age group, you can see the young population, especially the 5 to 9 years old, they have a very low mortality rate. But remember, they have various vectors. They have a 5 to 10x higher contagious rate. And we talked about this a few videos ago. So they don't really get sick. Most of them are asymptomatic, but they pass it on to the rest of the household. So these are interesting studies. So what's the prevalence in the world. And you can see that in some country there, like Peru, and that got really hit very hard, prevalence is estimated to be 50% of the population got exposed. The USA, we're estimating that to be like maybe 7 to 10%, depending on the state. And then some countries, especially the Asian countries there, it's still a very low number there. And a lot of Europe was having that explosion. They have a very low percent of the population that's carrying antibodies. And so there's a lot of room, unfortunately, for the virus to grow. To give you some idea, this is the prevalence in Belgium, which we all know got hit so hard there. It's estimated that maybe 5% of the population, has been infected and carry antibodies there. England is a little bit higher than that. So a very interesting study from Ontario in Canada, and they try to see, because they have less outbreaks than we do here, they're able to do contact tracing, and they're able to identify where was the infection, where did people get exposed, which is we're all kind of curious about that. And clearly the school daycare, which is the green portion there, has been the outbreak you see in August, September, and October. It has been one of the big driver there. The workplace is doing a much better job at keeping workers safe. And then it seems to be doing a better job also dealing with long-term care. I mean, remember, long-term care really took the hit in March because we did not know what was going on. So very interesting analysis there. Same thing for our area outside Ottawa. You can see the big green, the light green there. That's what basically drove a lot of these new cases. Another way to look at this, they broke it down by country, by areas like Toronto, Ottawa, Peel, and York. And again, in big orange, the school and daycare. And then the next one, of course, is long-term care, as you would expect. And then restaurants, depending on the area, this is kind of a dark blue here. So areas there, again, high density, easy to basically asymptomatic patients passing on to other people. And then, there's this argument we've always had to say, should you protect the economy versus the elderly? And, I don't want to go into the politics of it. But what this is showing is their relationship with the impact of GDP growth and the number of deaths. And you can see there's a reverse relationship, which is the more deaths you have, the more you have a decline in your GDP, because people are just afraid and they just, take a lot of protection that, they don't spend, and they kind of, some of the things we have watched here. So these two are not one or the other, they are linked. Let's look at the US. Not great news, unfortunately. We have had 121,000 daily cases. If you remember, in the lowest amount we had was 35,000. That was a few months ago. So we have gone dropped drastically. When I saw you here 2 weeks ago, it was 75,000. So it's a massive increase of up to 54% in 2 weeks. And unfortunately, the mortality rate, as we have seen in Europe, follows. It's just 8%, but I suspect it's going to go up drastically in the coming weeks. So we're going to pass 10 million over the weekend. And it's the Midwest. This whole area, the dark blue, is where we have the outbreaks. And remember, North Dakota, that's where they have a lot of mortality in nursing homes there. So unfortunately, the virus has been moving, and it's now really going into the rural area. And it's concerned because the rural area have less access to hospital beds and ICU. And I'm going to show you in a few slides that they're getting overwhelmed. Hospitalization, as you would expect, had a delay and is now going straight back up. People are starting to put, facilities in convention centers and all of that for overflow. Just to give you an idea of the ICU hospital bed, this is our most precious resource. And you can see when you're at 85%, that means you're really maximizing the capacity that we have. Typically, you like to be at 65 to 70%. And you can see Georgia, Alabama, Mississippi, Tennessee, Kansas, all of those, are unfortunately under stress. And so I think we need to really, really be careful. Midwest is what drives it, but the South and the West have an upsurge, not as bad as the Midwest. And unfortunately, the Northeast, as a result of that, is starting to follow. And this is the ultimate test. What is the week where you had the highest single record ever for any states? And you can really see the acceleration, the explosion that we're seeing on November the 1st. 19 states recorded the highest amount of daily cases, unfortunately. Children, a paper just got published by the American Academy of Pediatrics. There had been 853,000 cases. That's 11% of all the cases are for children. And that's a 15% increase in the last 2 weeks. Now, the good news is that most of them don't get hospitalized, but to give you an idea, it's still 0.5 to 6.7%. So the idea is that they don't get sick is not true. And again, you can see in the dark green area, the area which is the same that for the adults, where you have the hot spot, which is the Midwest area. We are back in the red zone. We used to have this nice graphic a few videos again. I was in the yellows and a couple of greens there in the Northeast, and the Northeast is starting to rise back up. So that's a worry there. We don't want to have another New York the way it's happening in Europe. So we all need to step up. The average in the US has gone up 48% based on these graphics there, which is a couple of days older. And you can see Michigan, 117% increase, Maine 245%, but I'm just highlighting in red the big population there. And these are massive increase in the period of 2 weeks. And that's when you know you have an outbreak that's accelerating again. Long-term care, unfortunately, is where there's a lot of the mortality there. You have still 1% of the population there, but 41% of the deaths. And look at North Dakota there, 80% of the deaths is in long-term care. And that's why you have the hot spot that I showed you earlier. So that's not good news at all. And California, for people in California, it's one of the best states to be in. We're having a little bit of an uptick because unfortunately the virus doesn't stop at the border. It's not at the level that we see in other part of the country there. The death rate is still going down, but remember there's a delay of 4 to 8 weeks depending on the severity of it. Our positivity went up 2 weeks ago. It was 2.7%. Now it's 3.3, but I think we're still in pretty good shape. So I didn't want to spend too much time on bad news for the video, but if you're interested in looking at prior video, one of my wonderful followers is putting together this PDF, which I'm putting a link on the YouTube, and you can go at prior videos and look at different keyword subjects as well as a time index. Okay, so please stay safe and watch my second video where I'm going to basically go back into what are all the things you can do to decrease your chance if you get exposed to have an infection. A very important video to look at. Help me spread the word. Please post on your social media. Thank you and stay safe.